So maybe you're getting ready to go to your first pelvic floor initial evaluation, that first appointment, and you have no idea what to expect. You might be really nervous. You might even have some anxiety about it. Maybe you're excited. I mean, of course, maybe you're hopeful, but today we're gonna talk about what exactly takes place in a pelvic floor initial evaluation. So the first thing that I always do with my clients is sit down with them and really hear their story. So I want to know all the details about what's been going on, whether it's only been a few weeks that you've been experiencing this, or maybe even a few years, or sometimes even decades that you've been going through this. But my goal with that first initial evaluation is to really hear your story and to get a good understanding of what your concerns are and what your goals are for treatment. So that usually takes up the first, 30 minutes, I'd say, of our appointment together. After that, we jump into an orthopedic assessment. So as you likely know by now, I am a physical therapist, of course, and I specialize in the pelvic floor. And so the next part of my assessment, as long as it's appropriate and called for, I will do an orthopedic assessment. What that means is I'm going to look at posture. I will check the way that you breathe. I'm going to be looking at your hips, your spine, your abdomen, your range of motion, and your strength and balance, and all these different things. Anything that's relevant to what your concerns are, that is what we're going to check. Because the pelvic floor, here's my little model. The pelvic floor does not act in isolation. It acts in a system full of our entire body from head to toe. So in other words, the pelvic floor is not just independently living on an island, it's greatly impacted by what's happening above and below it. So in other words, our spine, so even our neck, our mid-back, our thoracic spine, definitely our low back, and also below that, so our hips, our knees, our foot and ankle, or feet and ankles, I should say, those will greatly impact the pelvic floor as well. So first things first is I listen to your story. Second thing is going to be that orthopedic assessment with whatever is appropriate to look at for you during that assessment. And then the third thing that we get into is the actual pelvic floor assessment itself. So I always let people know, number one, first thing first, you have options. Just because you came into this appointment does not mean that I have to see anything. It doesn't mean that I'm gonna be, staring at your vagina or inside of your vagina. It's simply an option. It just helps me get more information about what's going on so that I can help you even better. So I'm gonna grab my model again. Typically what I talk about with my clients is that there's essentially 3 different options for the pelvic floor assessment, and they're essentially tiered. So the first option is, hey, if you are comfortable with an assessment, we may just do observation only. So what that means is basically if you see the vulva here, I would just essentially look at your vulva, just looking at things like skin irritation, if anything just looks maybe abnormal that you should see your gynecologist for, or your PCP, your primary care provider for. After that, I would ask you to do functions. So simply, give me a squeeze. Can you relax? Can you push? And that's it. I would never actually touch that individual or your vulva. So that's the first option. Second option is a little bit of observation once again, and maybe just a little bit of gentle palpation. Obviously I have gloves on, just gently feeling through some of those structures to see, are they tender? Do they have tone? Etc. And then lastly, there is the option of doing kind of all 3, which is observation, a little bit of gentle palpation, which is just that hands-on touch to the vulva, and a little bit of an internal assessment. And what that consists of is one gloved finger with lubricant on it, and I assess the 3 different layers of the pelvic floor. So actually I'm gonna grab my model back here again and show you what those layers are. So the first layer of the pelvic floor is the superficial layer. So you can see here, these muscles that form kind of like a diamond shape here, or a triangle shape, and then these muscles down and through here, these are all the superficial muscles, or the superficial layer of the pelvic floor. Our second layer is where all the sphincters live. So this is what I like to tell people when it comes to like leakage, especially the urethral sphincter, so where the urine comes out of, the vaginal sphincter itself, all of that, all those muscles live in the second layer. And then lastly, we've got the deep layer, which you can see all that red that you can see in there. All those are the deep hip muscles, deep pelvic floor muscles that can all be assessed internally. And all we do, is just basically I use my one finger. I'm just testing for things such as tone, any tenderness, any pain. And then I check for things like strength, coordination, especially is super important, especially if you are leaking. So if you are, sneezing and you're peeing on yourself, or you're jumping or running and you're peeing on yourself, definitely going to look at coordination to make sure these muscles are turning on at the right time so they can serve their function properly and you don't end up peeing on yourself or having any of these other pelvic floor issues. Essentially, once we're done with the pelvic floor assessment, I will be able to share with you, hey, this is what I found. And this is what we're going to do to get you to reach your goals. So I kind of have a 3-step process. It is assess, first of all. So we are going to assess you from the outside, from the inside, if you're comfortable with that. The next one is to address. So address the things that we found during that initial visit. And then the last one, the third little point here, is to achieve, which is achieve your goals. So if you are coming in for a pelvic floor initial evaluation with me, that is what you should expect. And if you are going to see somebody else for a pelvic floor initial evaluation, it might be a little bit different than what I just described, but at the same time, it should kind of have some of those similar pieces, right? Those similar factors. So there definitely should be that portion of sitting down and talking with you, an assessment, of course, and then really that assessment where the therapist tells you, hey, this is what I found and this is what we're going to do to get you feeling better. So that is what a pelvic floor initial evaluation looks like. One last thing that I want to share before I let you go for today is the concept of informed consent. That is so important to me and so dear to my heart, and I want to make sure that I share this with you. The idea that, consent is fluid in the sense that it can change at any moment. So if I explain all these things of the pelvic floor assessment and you tell me, yes, Gabby, I am good, let's do it. But then during the assessment itself, you start to become uncomfortable, and maybe I notice that, you're feeling a little bit anxious, or maybe your body language begins to change. I will always ask and check in and say, hey, how are you doing? Would you like me to stop? And I want you to know that you can always say no, and that consent is revoked, and that means that I stop immediately. And I want you to know also with informed consent that it means that we can always change what we're doing. So essentially, we don't have to go through an assessment. I've had people where I've never looked at their vagina during the entire time that we worked together, and they still got better. So I wanted to make sure I share that with you today. I hope that you have a wonderful rest of your day, and I'll see you in the next video.